Almost 50% of men after 40 experience some degree of erectile dysfunction. This problem starts below the belt, but it rarely stays there because it often serves as the first visible sign of heart disease. It can appear 5 years before a heart attack. That's why impotence is not just a sexual issue, it's an early vascular warning. Erectile dysfunction, also called impotence, means persistent inability to achieve or maintain an erection deep enough for sexual activity. It's not about libido or desire, it's about consistency of performance. Medically, if it lasts more than 3 months, it's diagnosed as erectile dysfunction. This condition is extremely common yet underreported. Men with diabetes, about 70% develop erectile dysfunction because of nerve and blood vessel damage. Men with high blood pressure, around 60% have erectile dysfunction. Smokers have 50% higher risk because nicotine causes vascular constriction. Obese men suffer 3 times more often than those normal weight. Low testosterone explains about 25% of cases. Antidepressants and beta blockers cause roughly 20% of cases of erectile dysfunction. Psychological stress and relationship conflict contributes around 30%, and yet 1 in 10 men seek medical help. The rest silently adapt or avoid intimacy. Erection begins in the brain. Desire activates parasympathetic nervous system, which releases nitric oxide into the arteries of the penis, and nitric oxide relaxes them through muscle, allowing blood to fill the corpus cavernosum, and veins compress, trapping the blood, and erection is maintained. Impotence happens when the system breaks. The brain does not send signal, for example, due to stress or anxiety or depression. The arteries can't dilate due to atherosclerosis or hypertension. The nerves can't transmit signals due to neuropathy or spinal injury. The hormones are too low, like testosterone deficiency. Most cases are organic. 80% of cases are organic, neurological or hormonal. Only about 20% are purely psychological, but in real life, most are mixed because the body and mind work together. The key diagnostic clues are loss of morning erections and it strongly indicate organic origin of the problem. Normal erections during sleep or masturbation, but not with the partner, it indicates psychological problem. When problem has gradual onset, it's organic. With sudden onset, it's psychological. Weak rigidity or early detumescence indicates vascular problems. Weak rigidity plus loss of body hair indicates hormonal problems. Numbness in genitals means neuropathic problems. In young men, erectile dysfunction may indicate early diabetes, since microvascular neuropathy often appears there first. Snoring and erectile dysfunction are linked because sleep lowers estrogen and testosterone. Morning erections remains one of the most valuable diagnostic clues. We tell whether the issue is psychological or physiological and physical. Other physical triggers and hidden causes are long cycling can compress the pudendal nerve, alcohol consumption. Sometimes it helps arousal but blocks performance because it suppresses nitric oxide. Zinc and magnesium lowers testosterone. VHPA is common in chronic erectile dysfunction. Depression doubles the risks because serotonin imbalance suppresses both libido and nitric oxide signaling. Medications methods like ACE inhibitors improve erectile function, but beta blockers can worsen it. Chronic pornography use desensitizes dopamine receptors. reducing real-life arousal. Unchecked testosterone therapy can worsen erectile function if estradiol rises too high. Finasteride, which is used for hair loss and prostate, may cause persistent erectile dysfunction, but it's rare. And thyroid imbalance, both hypo and hyperthyroidism, can cause erection. Erectile dysfunction often coexists with premature ejaculation due to the same anxiety feedback loop. Several chronic diseases are linked to erectile dysfunction, like chronic kidney disease. It impairs both vascular and hormonal balance. Sleep-apnea lowers oxygen and testosterone. Chronic opioid use suppresses gonadotropin and testosterone. Chemotherapy and radiation. Diagnosis always begin with history and blood tests because the cause must be found before treatment works. Tests include total and free testosterone, prolactin, TSH, glucose, and lipids. Nocturnal erection test if normal, psychological if absent, if organic. Penile Doppler ultrasound. The first-line treatment is PDE5 inhibitors like sildenafil and tadalafil. They block the phosphodiesterase 5 enzyme because that enzyme destroys cyclic GMP, a molecule that relaxes the penile muscle. By keeping cyclic GMP longer, they increase blood flow and strengthen erection. Sildenafil brand name is Viagra and tadalafil brand name is Cialis. The onset usually within 1 hour. Slightly shorter onset time has Cialis. Duration, the effect duration for sildenafil is 7 hours. For Cialis is 36 hours. So doesn't affect the absorption usually, but in case of sildenafil, fatty food may delay absorption. Usually for sildenafil is from 25 to 100 milligrams per minute, and for Cialis 10 to 20 milligrams, and 5 milligrams if used daily. So regular intake Cialis is better. They have mild side effects like headache, flushing, vision, sometimes in case of sildenafil. And for Cialis, headache, mild back pain or muscle pains. And generally, tadalafil is considered safe for long-term use because it causes less blood pressure drops and allow daily microdosing. And sildenafil is faster, ideal for occasional use. And both are forbidden with nitrates because together they can cause severe hypertension. Second-line treatment is used when testosterone is also low, less than 300 grams per deciliter. Some include gels, injections, or parts, but always monitor estradiol and hematocrit levels. Third-line treatment is non-drug treatment like working erection devices, draw blood in by negative pressure. It has success rate around 80%. Ultrastatic injections or gels direct effect on penile smooth muscle. Success rate very high. And penile impulse is a soluble solution, and it has 85 satisfaction rate. There are some supplements also which has some effect, like arginine. 3 to 6 grams per day. It increases nitric oxide because it's precursor of nitric oxide. And effectiveness is plus 20 to 30%.